Good afternoon. This is Dr. Rosario. In the previous lectures, we discussed the physical and chemical methods used to control microbial growth. In this video, we will put these ideas into context and discuss common infection control practices within the laboratory, during patient care, and in the community at large. The spread of infectious diseases depends on multiple factors that create what we call the chain of infection. These include the characteristics of the pathogen, potential reservoirs, where the pathogen exits the body, the mechanisms of transmission, where the pathogen enters the body, and susceptible hosts. Each one of the links in this chain can serve as a point where an intervention can be used to break the disease cycle. For example, food is often a reservoir for Salmonella, but proper cooking can eliminate it and prevent infection. If you have a respiratory disease like COVID, face masks can be an appropriate intervention to limit the spread, blocking both the portal of exit and the portal of entry. All of these different factors must be taken into account when developing policies and procedures for disease control. First, let's look at disease control in the context of the laboratory. Here in the United States, the National Institutes of Health and the Centers for Disease Control and Prevention have established guidelines for working with microorganisms in the laboratory, whether for research or for diagnosis. These guidelines were developed to protect the health of the laboratory workers and to protect the general public. Each organism is assigned a biosafety level. The classifications are made considering the ability of the organism to establish an infection, the severity of its associated disease, its transmissibility, and what is being done with the organism and the route of exposure. BSL-1 organisms have the lowest risk of impacting health, while BSL-4 organisms have the highest risk. In a biosafety level 1 laboratory, the microorganisms are unlikely to pose a risk to human health. An example might be Saccharomyces cerevisiae, bread yeast, or the common strain of E. coli, K12. In a BSL-1 lab, scientists use standard lab safety practices and aseptic technique. The microorganisms can be worked with on the benchtop. As far as safety equipment, gloves, eye protection, and a lab coat may be worn. The lab itself must have a sink for hand washing and a door. BSL-2 microorganisms are those that pose a moderate risk to human health. An example is Staph aureus. In addition to the BSL-1 laboratory considerations, a BSL-2 laboratory must have a biosafety cabinet to reduce the risk of infectious aerosols, an eye wash station, and an autoclave to decontaminate equipment. The doors of the lab should be self-closing and only authorized personnel are permitted to enter. A BSL-3 pathogen has the potential to cause a lethal disease via inhalation. Yersinia pestis, the cause of plague, is a BSL-3 pathogen. Access to the laboratory is restricted, and people that work in the lab are monitored for illness. Personnel should receive vaccinations against the pathogen if they are available. Personal protective equipment may include a respirator that covers the entire face or just the nose and the mouth and filters the air. All of the work with microbes is done within a biosafety cabinet. The lab must have 2 sets of self-closing and locking doors, and it should have a directional ventilation system to prevent the air within the room from mixing with the air in the rest of the building. BSL-4 is the highest risk category. The pathogens that are handled in these laboratories are often lethal and transmitted through inhalation. Examples are Ebola and smallpox. People working in these laboratories must change their clothes before entering and shower when they leave. There are extensive decontamination protocols to ensure that no pathogens leave the laboratory. Lab staff work within a biosafety cabinet or wear a self-contained positive pressure suit to avoid contact with the pathogen. These laboratories are usually in a separate building or within a restricted area. BSL-4 laboratories are highly regulated and monitored. There are less than 20 of these laboratories in the United States. Now let's turn our attention away from the laboratory to patient care. It is important that proper precautions are put into place to prevent the transmission of disease within the healthcare environment. Hospitals, long-term care facilities, and doctors' offices present unique challenges because you may have a sick individual that can harbor pathogens. You have healthcare workers and potentially immunocompromised individuals all within the same location. Standard precautions are common sense practices that are regularly used in patient care, whether a known pathogen is present or not. The first is proper hand hygiene. It is imperative that healthcare workers wash their hands before and after treating a patient. By doing so, they significantly reduce the risk of disease transmission. Personal protective equipment such as gloves, masks, and eye protection should be worn when there is a risk of exposure to blood or body fluids. All individuals should cover their mouths when they cough or sneeze. I did say it was common sense. Care should be taken when handling sharp objects. Aseptic technique should be used when providing injections, and all sharps should be disposed of in proper containers. Equipment that is used in patient care should be properly cleaned and disinfected and sterilized as necessary. Finally, environmental surfaces should be regularly cleaned and disinfected between patients. Transmission-based precautions are additional procedures used to prevent disease transmission when caring for patients who may be infected with pathogens. These precautions are disease-specific and may require the use of additional personal protective equipment, limiting patient transport, placing patients in private rooms, or utilizing specialized isolation rooms. Infection control within the healthcare environment is complex and requires partnership between all the different parties that are involved in patient care, from the nursing staff to the custodial workers. Finally, the last thing I wanted to touch on is strategies that are used to prevent disease transmission within the community at large. This is not an exhaustive list, but should give you an idea of the many different avenues available to prevent the spread of infectious diseases. So we're going to talk about infrastructure, vector control, public policy, surveillance and outbreak investigation, education, and vaccination. The first aspect of community disease control that I wanted to discuss was infrastructure. We oftentimes take this for granted here in the United States because we have a very robust infrastructure for providing clean water, for disposing of waste, etc., etc. Our government provides those services for us. But elsewhere in the world, it's not the case. So you can see these are two little girls. They live in Haiti, and this was after the earthquakes about 10 years ago. And you can see they're getting their drinking water for the day. And that drinking water is contaminated with garbage, right? You can see the bottles littering the ground around this stream. And really, this is just kind of a wastewater runoff area that they're getting their water from. As you can imagine, diarrheal diseases and other diseases that can be transmitted through the fecal-oral route, they're very common in this area, in this community, because they don't have adequate infrastructure. One of the number one things we can do worldwide to protect health and to prevent infectious diseases is to simply provide clean drinking water and proper disposal of human waste. Next thing on my list is vector control. So this is actually a picture from Hillsborough County, which is where Tampa is. And you can see this is a mosquito control truck. And they drive around through the community spraying chemicals to reduce the number of mosquitoes in the area. Now, mosquitoes are a pest, right? They bite, they are annoying, but they also transmit disease. And a very important part of controlling mosquito-borne diseases is actually controlling mosquito populations themselves. And this is another part of our government infrastructure that you don't see every day, but is integral to protecting your health. Public policy and legislation play an important role in protecting human health when it comes to infectious diseases. Schools, daycares, restaurants, and even tattoo parlors are regulated by local and state governments. So for example, here I have a picture of a tattoo parlor, and these businesses have to be licensed and inspected in order to operate. Sometimes we rely on our elected politicians to enact policies that will protect human health. So as we saw with COVID-19, politics can play a really important role in the decision-making process in terms of making policies that have a direct impact on public health. One important place where we see public policy impacting human health is in terms of quarantine and making decisions about who should be quarantined and isolated and who shouldn't, right? We saw this in the context of COVID. You know, one of the classic stories of quarantine was Typhoid Mary. Typhoid Mary, her name was Mary Mallon, but she's known more famously as Typhoid Mary. She was somebody who immigrated from Ireland in 1884. Now you have to keep in mind the political context here. This was a time when there were lots of immigrants coming to the United States from Ireland, and they were mostly poor, working class individuals. So Mary Mallon was a housekeeper and a cook. She worked in the New York City area. She was identified as a carrier of Salmonella typhi, the causative agent of typhoid. Now, the way that she was identified was through an outbreak investigation. You had individuals who were getting sick in this area, and the health department was investigating to figure out what was the source of the infection, and they traced it back to Typhoid Mary. She was somebody who would shed the bacteria in her fecal material, but she did not herself get sick. Well, as a result of this discovery that she was the source of the illness, she was asked not to work as a cook anymore. She continued to do so because that was her only source of income. Eventually, she had to be imprisoned because she wouldn't stop working as a chef. Now, there was huge public outcry against this because here you had this woman, she was just trying to make a living, and she was being held against her will. She was eventually released and then went back to working as a cook and got more people sick. Finally, they put her in a special quarantine facility on an island off the coast of New York City, and she actually spent the rest of her life there. So that's a really sad story. She really kind of lost everything as a result of an infectious disease, but she was a real risk to her community. So it is a part of the role of your public health officials to decide who are people who are at risk and what they need to do to mitigate that risk. Another example of quarantine, and this one's more modern, is Kaci Hickox. So Kaci Hickox was actually somebody who worked with Ebola patients in West Africa back in 2014. And if you remember, this was when we had a really big outbreak of Ebola in Liberia and Sierra Leone. And Kaci worked with Doctors Without Borders. And when she came back to the United States, she was not sick. She was not carrying the disease. She tested negative for the disease. However, the government officials in New York, where she was from, forcibly quarantined her upon her return to the United States. And it became quite a media circus around her at the time because people were freaking out. They were worried about the risk of Ebola, when really there was no true risk. She was happy to stay at home and self-quarantine, but instead they forced her to be in a quarantine facility. So these are just a couple of examples of quarantine. We, of course, have seen in recent years with COVID-19 the effects of lockdown, right? And how that can affect our economies and how that can affect our businesses, not to mention our personal lives. So it's very important when public health professionals are making these decisions about whether or not to separate individuals from the rest of society. What are the impacts of that, and what is the potential risk? It's really hard to separate. I know I mentioned this with our lecture on vaccination. Humans are terrible at assessing risk, and it's very difficult to separate politics from science in this particular context. Here we have a picture from Shanghai recently. So Shanghai has been under a lockdown, a very, very strict lockdown for several months, and they're actually just coming out of it now because of a COVID-19 outbreak. So in China, they have invoked very strict lockdown procedures. In fact, these individuals are volunteers that are bringing groceries to people that aren't even allowed to leave their homes as a way to try to prevent the spread of COVID. Of course, another important aspect of community disease control, besides those outbreak investigations and quarantining and isolating, is education. So your public health departments, whether it's the CDC or the Florida Department of Health, they spend much of their time and their resources on educating the public about potential risks. So these are just some examples of some infographics that have been put out by the CDC to educate individuals about different infectious diseases. The more informed people are, the better they can make decisions about their own health care rather than relying on other people to make decisions for them. And of course, finally, to circle back, the last piece of community disease control that I wanted to mention is our vaccination, right? So here are the childhood vaccinations that are recommended by the Centers for Disease Control and Prevention. And you can see, there's a lot of vaccines at our disposal that we can use to protect public health. And again, we rely on public health agencies to, create regulations and guidelines that allow us to make decisions about our health care. So, for example, many of our childhood vaccinations are required for entry into public school systems. And there's good reason for that, because those are places where diseases oftentimes spread. Kids that aren't properly vaccinated or completely vaccinated are not allowed to go to daycare unless they have an exemption from their doctor. So again, there are a lot of different pieces to infection control and disease control. These are just a selection of a few of them.